As men age, prostate health becomes an increasingly important concern. Yet, it's often not given the attention it deserves until significant issues arise. But what if I told you that a simple, natural activity like masturbation could have a profound impact on your prostate health almost overnight? In today's video, we'll dive into groundbreaking research that unveils the surprising and often overlooked benefits of masturbation for prostate well-being. You'll discover insights that many aren't aware of, along with a proven method to enhance your experience and achieve more satisfying orgasms. This could be a game changer for your health and overall vitality. Chapter 1: Debunking Common Myths and Fears. For many men, concerns about prostate health often bring to mind long-held myths about the dangers of frequent masturbation. Some have been led to believe that masturbation can weaken the prostate, cause chronic inflammation, or even increase the risk of prostate cancer. These fears are understandable, given that discussions around men's sexual health remain taboo in many cultures, leaving room for misinformation and anxiety to thrive. Historically, masturbation has been unfairly blamed for a wide range of ailments, from blindness to mental illness. This notion, rooted in Victorian-era medicine, painted masturbation as a harmful activity, leading to both physical and mental deterioration. These claims have long since been debunked by modern medical research, but unfortunately, the psychological stigma they created continues to impact many men today. Despite advancements in our understanding of human sexuality, misconceptions about masturbation's dangers persist. In reality, masturbation is a completely natural and normal physiological process, not only for men, but also for women. When done in moderation, it is not harmful and can even have positive effects on sexual health. So, what does the latest research reveal? A groundbreaking study conducted by the Harvard T.H. Chan School of Public Health followed the ejaculation habits of nearly 32,000 men over the course of 20 years. The results were both surprising and enlightening. The study found that men who ejaculated 21 or more times per month had a 31% lower risk of developing prostate cancer compared to those who ejaculated only 4 to 7 times a month. This is a game-changing finding that challenges the old myths surrounding masturbation and prostate health. I'll say this again because it's worth repeating. Ejaculating more frequently is associated with a lower risk of prostate cancer. Rather than causing harm, the evidence suggests that masturbation has a strong protective effect on the prostate. So, if you're still holding on to outdated fears or worries about masturbation, it's time to get a clearer perspective on the amazing benefits masturbation has to offer right now. Chapter 2: The Benefits of Masturbation for Prostate Health. Let me share the story of a patient named Robert, a 58-year-old from Los Angeles who came to me with concerns about his prostate health. Robert had been experiencing early signs of prostate enlargement, and like many men his age, he was worried about the potential decline in his sexual health. His symptoms included frequent urination, especially at night, and a decrease in his sexual drive. He had heard a lot of conflicting information about masturbation and its effects on prostate health, some of it suggesting that regular ejaculation could harm the prostate. But after discussing his concerns, we agreed on a plan to help him maintain his prostate health, and part of that plan involved regular masturbation. What happened next was nothing short of surprising. One of the most significant changes Robert experienced was a marked improvement in blood flow to his prostate. When he started regularly masturbating, he noticed an immediate difference. You see, when you stimulate yourself, your body experiences an increase in blood flow throughout the pelvis, and this includes the prostate. Research published in the Journal of Sexual Medicine shows that sexual arousal can increase blood flow to the prostate by up to 40%. This enhanced circulation means that the prostate and surrounding tissues receive more oxygen and essential nutrients, aiding in their natural regeneration and repair. This was crucial for Robert. As men age, circulation naturally slows down, and without proper blood flow, prostate tissue can begin to deteriorate over time. The lack of oxygen and nutrients can lead to shrinking, which affects not only the prostate, but also the penis and other surrounding structures. Improved circulation helps combat this. In fact, a study from the University of California, San Francisco, found that men with better pelvic blood circulation had significantly lower rates of prostate enlargement and inflammatory conditions. For Robert, this increase in circulation led to improvements in both his prostate health and urinary flow. Think of it like gently exercising the prostate. Regular stimulation keeps it nourished and ready for optimal function, similar to how physical exercise benefits the rest of the body. According to research from Johns Hopkins University, men who maintain regular sexual activity, including masturbation, have 23% better blood flow markers in their pelvic region compared to those who are sexually inactive for long periods. Robert's follow-up exams showed a significant improvement in his prostate size and urinary flow within just 1 month of maintaining regular ejaculation. This simple practice was like a daily workout for his prostate, keeping it healthy and functional. But the benefits didn't stop there. As Robert continued this routine, another key change occurred: the natural cleansing of his reproductive tract. The prostate produces about 30% of the fluid in semen, and it generates 0.5 to 2 milliliters of prostatic fluid each day. If these fluids aren't released regularly, they can accumulate and cause discomfort or lead to more severe issues like prostate enlargement. For Robert, regular masturbation helped clear out this accumulated fluid, preventing the buildup that could lead to problems. It was like performing routine maintenance on a system that needed to be kept clean and free from blockage. This is a critical point, especially for older men. The National Institute on Aging reports that over 50% of men in their 60s and up to 90% of men in their 80s experience benign prostatic hyperplasia, BPH, a condition that leads to prostate enlargement. Regular ejaculation helps prevent the fluid from stagnating, reducing the risk of this and other related conditions. The idea of semen retention, where the fluids are held in and not released, can actually increase inflammation and discomfort over time, something Robert was all too familiar with before starting his regular masturbation routine. Additionally, when prostatic fluid stagnates, it becomes more alkaline and creates a breeding ground for bacteria. This can lead to prostatitis, an inflammation of the prostate, which becomes more common with age. The Mayo Clinic notes that when prostatic fluid sits for more than a week without being released, its chemical composition changes, increasing the risk of bacterial growth. Ejaculation helps flush out old secretions, cellular debris, and potential toxins, ensuring the prostate stays healthy and free of inflammation. By engaging in regular masturbation, Robert was actively promoting a healthier environment for his prostate and reducing the risk of chronic conditions like prostatitis, BPH, and even prostate cancer. The American Cancer Society has noted that chronic inflammation in the prostate is linked to an increased risk of prostate cancer, so this natural cleansing process was not just beneficial for Robert's comfort, but also for his long-term health. The effects of regular ejaculation go beyond just the physical benefits. For Robert, it wasn't just about keeping his prostate healthy, it was about the hormonal impact as well. During ejaculation, the body releases endorphins, the brain's natural feel-good chemicals. These endorphins have a profound effect on mood, easing stress, promoting relaxation, and acting as natural painkillers. For Robert, this hormonal release was a game changer. As he experienced greater mental clarity and a reduction in stress, he found himself feeling more at ease and less anxious about his health. Moreover, masturbation also stimulates the release of oxytocin, often called the bonding hormone. Oxytocin is known for fostering feelings of connection and intimacy, but it also plays a significant role in reducing anxiety, lowering stress levels, and regulating inflammation. This hormonal balance wasn't just beneficial for Robert's emotional well-being, it helped support prostate function too. A study from the University of Pittsburgh found that men with better hormonal balance through regular sexual activity had 38% fewer prostate-related health issues. The hormonal boost Robert experienced through regular masturbation wasn't just about relieving tension or enhancing mood, it was about maintaining a healthy hormonal environment, which is essential for both emotional and physical health. This boost supported his prostate health by reducing the risk of inflammation, which can impair prostate function and contribute to conditions like chronic prostatitis and BPH. In a society where many men in their later years struggle with anxiety, depression, or declining libido, Robert's experience showed us just how powerful a simple, natural activity like masturbation can be in maintaining both prostate and overall health. It's not about chasing fleeting pleasure. It's about harmonizing with the body's natural rhythms and supporting long-term health. Robert's story is a testament to how a regular, healthy self-care routine can benefit not just the prostate, but the entire body and mind. By embracing this practice, Robert was able to significantly improve his prostate health and quality of life. And if you're struggling with similar issues, his experience offers valuable insight into the benefits of regular ejaculation for prostate health. And if you agree with Robert, please enter a 1 below in the comments section to let me know you're still following the following clear health benefits of regular masturbation. Chapter 3. Masturbation offers a number of overall health benefits. Let's continue with Robert's story. After experiencing some notable improvements in his prostate health from regular masturbation, Robert began to notice other unexpected benefits that went far beyond just his prostate. At first, he was only focused on addressing his prostate enlargement, but soon, he realized how much better he was feeling in other areas of his health. Robert's experience is a perfect example of how regular masturbation, when done in moderation, can offer a wide range of overall health benefits for men. One of the most significant changes Robert felt was a remarkable reduction in stress. In the weeks following his decision to practice regular ejaculation, Robert found that his anxiety levels decreased and his mood improved. This is not just a coincidence. During orgasm, the body releases a surge of serotonin and dopamine, two neurotransmitters that play a key role in promoting relaxation, happiness, and mental clarity. At the same time, cortisol, the hormone most closely linked with stress, naturally decreases. This hormonal shift helped Robert's body enter a calmer, more restful state, making it easier for him to manage the stress in his life. The positive biochemical reset that occurs during orgasm helped him unwind and cope with work pressures and other day-to-day stresses. For Robert, the impact on his sleep was equally impressive. Many men in his age group, especially those dealing with anxiety and work-related stress, struggle with sleep disturbances. However, after adopting a regular masturbation routine, Robert reported that he was falling asleep faster and experiencing deeper, more restorative rest. This improvement was in part due to the calming effects of reduced cortisol levels and the release of feel-good hormones. In fact, scientific research supports this, showing that sexual release and orgasm can help improve sleep quality by facilitating a more relaxed, stress-free state. For Robert, this was a much-needed change, as he had struggled with insomnia for years. Masturbation also had a positive impact on Robert's sexual performance, something he had been concerned about as he aged. Regular practice allowed Robert to become more attuned to his body's responses, increasing his awareness of his own arousal patterns. This enhanced body awareness gave him more control over his sexual responses, helping him reduce instances of premature ejaculation, and, ultimately, boosting his overall sexual satisfaction. Many sex therapists recommend masturbation as a way for men to practice control, build confidence, and extend pleasure in intimate situations. But it didn't stop there. Robert also began to notice cardiovascular improvements that he hadn't expected. During sexual arousal and orgasm, the body experiences an increase in heart rate and improved circulation. These responses are similar to moderate aerobic exercise, which is beneficial for cardiovascular health. As blood vessels dilate, the delivery of oxygen throughout the body improves, including to the heart. Research published in the American Journal of Cardiology shows that regular sexual activity is associated with reduced cardiovascular risk, particularly when combined with other healthy lifestyle choices. Robert had been concerned about his heart health, especially as he entered his 60s. But after a few months of regular ejaculation, Robert began to feel a noticeable difference in his overall vitality. He wasn't just benefiting his prostate. His cardiovascular health was improving too. Regular masturbation offered more than just sexual health benefits. It was becoming a simple way to support his long-term heart function. One of the most surprising effects Robert experienced, however, was a stronger immune system. Over time, he noticed that he was getting sick less often, and his recovery from minor illnesses seemed faster. This can be attributed to the immune-boosting effects of regular masturbation. Scientific studies show that sexual activity increases levels of immunoglobulin A, IgA, an antibody that plays a crucial role in protecting the body against infections. A study from the Journal of Behavioral Medicine found measurable increases in IgA levels following orgasm. As Robert's regular masturbation routine continued, his immune system became more resilient, which was especially beneficial as he got older. This boost in immunity, along with the stress-relieving effects and cardiovascular benefits, made Robert feel like a new man. He realized that masturbation wasn't just a way to take care of his prostate or relieve stress, it was an overall health tool. His experience highlights how a simple, natural act can have profound effects on a man's overall well-being. As Robert's story demonstrates, regular masturbation is about more than just improving prostate health. It offers a holistic approach to maintaining mental, physical, and sexual health. So, if you're still skeptical about the broader health benefits of masturbation, Robert's journey is a powerful reminder of how embracing this natural practice can enhance your overall health in surprising ways. If you're looking for additional ways to support your circulation, particularly after age 60, I've created a video on 6 foods that help increase blood flow to the penis, which you can find linked below in the description. But for now, let's continue exploring how masturbation can support even more aspects of your health. As Robert's story demonstrates, regular masturbation is about more than just improving prostate health. It offers a holistic approach to maintaining mental, physical, and sexual health. So if you're still skeptical about the broader health benefits of masturbation, Robert's journey is a powerful reminder of how embracing this natural practice can enhance your overall health in surprising ways. If you're looking for additional ways to support your circulation, particularly after age 60, I've created a video on 7 foods that help increase blood flow to the penis, which you can find linked below in the description. But for now, let's continue exploring how masturbation can support even more aspects of your health.
Chapter 4. Determining your optimal ejaculation frequency. Now that we understand the science, the important question is, how often should you ejaculate for optimal prostate health? While the Harvard study found benefits from ejaculating 21 times per month, which reduced the risk of prostate cancer by 31%, this should be viewed as an observation, not a prescription. The goal is to find a healthy, sustainable ejaculation frequency that works for your individual situation. For men in their 40s, most research suggests that ejaculating 3 to 4 times per week may be optimal. At this stage of life, testosterone levels remain relatively high. The prostate responds well to regular stimulation, and overall sexual energy tends to be strong. Regular release during this decade may help preserve prostate function while lowering inflammation and supporting hormonal balance. As men enter their 50s, both testosterone and sexual desire begin to gradually decline. Nonetheless, ejaculation 2 to 3 times per week continues to provide important protective benefits. This is also when prostate cancer risk rises significantly, making regular release especially valuable as part of a preventative health routine. For men in their 60s and beyond, the optimal frequency is generally 1 to 2 times per week. Older men still experience measurable benefits from frequent ejaculation, but adjustments should be made to accommodate natural shifts in hormone levels, energy, and overall health.
That said, men should avoid treating ejaculation as a quota. Sexual health is best guided by the body's natural rhythm rather than a calendar. Forcing yourself to meet arbitrary numbers can lead to unnecessary stress or anxiety, and can actually increase inflammation and weaken immune defenses. True optimization comes from paying attention to your natural sex drive, finding a frequency that feels right, and allowing your body to regulate itself without pressure or guilt. It is also essential to consider personal medical conditions. Men with heart disease, diabetes, or an enlarged prostate should consult a urologist before making significant changes to their sexual routine. Medical guidance ensures that the benefits of frequent ejaculation are achieved safely and in alignment with overall health needs. Finally, it is not just about how often you ejaculate, but the quality of those experiences. A complete orgasm with strong pelvic muscle contractions is far more beneficial to the prostate than partial or rushed releases. High-quality orgasms not only provide better circulation and glandular clearance, but they also support stronger hormonal responses and greater satisfaction. Chapter 5. Simple Ways to Connect. Well, you don't need to recapture your youth to feel alive and energized. What you need is a gentle, mindful approach to reconnecting with your body's capacity for enjoyment and well-being. This has nothing to do with performance or meeting any external expectations. It's about honoring your body's constant need for care, attention, and pleasure.
The first step is to create your personal comfort zone. Choose a private space where you feel completely at ease, whether it's your bedroom, a favorite chair, or a quiet corner of your home. Adjust the lighting, set a comfortable temperature, and perhaps add soft music or calming scents. By intentionally creating this environment, you are sending a powerful signal to your nervous system that you are safe, valued, and deserving of care. Once your environment supports you, begin to connect through the breath. Sit or lie comfortably with one hand on your chest and the other on your belly. Allow your breathing to slow and deepen, feeling the gentle rise and fall of your body. Breathwork is not only the foundation of mindfulness practices, but it also plays a crucial role in healthy sexual connection, grounding you in the present moment and allowing your body to respond naturally.
From here, cultivate gentle body awareness. Begin with soft, non-sexual touch on your arms, face, and neck. Notice which areas feel alive and sensitive, and which may feel disconnected or less responsive. Both sensations are natural, and neither should be judged. This type of mindful exploration strengthens neural pathways between the brain and body, a process supported by research in somatic therapy and neuroplasticity. By touching with curiosity rather than expectation, you train your nervous system to reestablish presence, sensation, and intimacy with yourself. As your comfort deepens, you may gradually explore areas of the body that feel pleasurable. The goal here is not orgasm or performance, but discovery, listening to your body and honoring what feels good in the present moment. This is not about achieving orgasm or repeating any past experience. It is about discovering what brings you comfort, pleasure, and a sense of aliveness right now, in this stage of your life. Finally, take time to integrate and be grateful. When you feel complete, place your hands gently on your chest or belly, close your eyes, and take a few deep breaths. Allow yourself to notice the fullness of the experience. By ending with gratitude, you transform the practice from a momentary exercise into a deeply restorative ritual. At its core, this process is not about recapturing the past, but about embracing the present. It is about rediscovering the joy of being in your body, cultivating intimacy with yourself, and nourishing both your physical and emotional health. When practiced with patience and compassion, these small steps create profound shifts, reminding you that vitality and pleasure are always within reach. Conclusion. As we come to the end of this journey together, I want to leave you with this truth. Your body, your health, and your right to pleasure do not decline with age. You don't need expensive treatments or complicated procedures to make a difference. Something as simple as masturbation can help you turn things around. If this message resonated with you, share your thoughts in the comments. What surprised you most? If you found this valuable, please like, share it with someone who could benefit, and subscribe for more science-based insights on men's health and aging well. I'm Dr. Elizabeth, a urologist with many years' experience in prostate care and men's health. Thank you for watching, and remember that investing in your health today creates dividends for years ahead.